పెయిన్ క్లినిక్ లో ఎటువంటి ఫీచర్స్ ను మనం చూడవచ్చు అంటారు?
How to prevent most of our elderly ladies or elderly age group patients which we see are generally with backache or knee pain, and there are some methods and means to avoid certain kind of stresses on the knee or the back. The knee pain can be avoided by squatting for too long, or using Indian toilet, or doing puja sitting on the ground. We should avoid all these postures and avoid prolonged sittings. The backache also is another modality which comes with age, or comes with disc prolapse, or comes with osteoporosis, or faulty postures. So all these faulty postures, prolonged sitting or prolonged standing, or sitting for very long hours on the chair in front of the computer should be avoided. And simultaneously weight reduction, and most of these patients will also have excess weight, so we should restrict their intake and try to control their weight, and with physiotherapy and some kind of exercises for the strengthening of the back muscles or the knee muscles helps these patients to recover better. And these are the few precautionary measures which we have to take for ourselves and our body, and to preserve our knee as well as our back for longer time. Intentions of starting a pain clinic is basically to prevent any surgical intervention for these patients who are literally scared of surgeon's knife. So we try all means and methods like combination of physiotherapy, rehabilitation, exercises, counseling, medicines and exercises, so that helps the patient to recover a bit. And ultimately, if a particular knee is so bad that nothing can help, or the disc is so bulging that it is causing symptoms on the motor symptoms or sensory symptoms, that's a time when we actually send these patients for surgical intervention. Till then, we try to prolong surgery as long as possible, or try to treat the patient not to go for surgical procedures.
నొప్పులతో బాధపడేవారు ఎటువంటి డైట్ తీసుకుంటే మంచిదంటారు?
Diet has also a very important role to play in person's life as well as in management of pain. There are certain diets which should be avoided, especially for patients who are suffering with uricemia or increased uric acid levels in the joints. They have to be careful and avoid such food intake which increases their uric acid levels. Then the food should be balanced food. It should have a lot of vitamins, it should have minerals, it should have proteins, and less of carbohydrates in after 45 to 50 years age. Protein intake should increase a bit, and less of carbohydrate intake. So these are few things which you have to take precautions on the dietary front, and as far as possible try to have healthy food, healthy diet, do regular walking, do regular exercises, try to preserve your joints, try to preserve your back so that you don't need a surgical intervention. And that's one of the methods of reducing pain in the back or in the knee.
సాధారణంగా నొప్పుల చికిత్సకు ఎంత సమయం పడుతుందండి?
Most of these patients who come with severe osteoarthritis of the knee joint, generally it takes about a week or 10 days for us to give him a proper pain relief. We try with medication first, we try with quadriceps strengthening exercises, we try to involve a physiotherapist with ultrasonic massage, and then if nothing works, then we do intervention with ozone therapy, and that helps a patient in relieving of his pain. It takes about 3 to 5 days, and generally the results are good. For backache, we generally ask them to change their postures frequently, not to sit for prolonged hours, and even if you are sitting for long hours, go for a walk every 45 minutes for 2-3 minutes, and then come and sit back on your workplace. So these are few things which you have to do. You have to build up your back. There are exercises to strengthen your back, there are exercises to strengthen your other joints. So I try to tell every patient, whenever he comes, I give him a chart, I give him the exercises protocols what he has to follow. I involve a physiotherapist and try to get ultrasonic massage if that helps in strengthening of quadriceps and low backache. So these are multi modalities which can be tried which can work for these patients without letting them undergo a surgeon's knife.
ఒక సీనియర్ డాక్టర్గా మీరిచ్చే మెసేజ్ ఏంటి?
So my take-home message for all patients who come to the pain clinic is eat healthy diet, which should have a balanced diet consisting of proteins, vitamins, minerals. Have a regular exercise every day for at least half an hour to 45 minutes, and do not have wrong postures. Try to reduce your weight a little, and all this put together will reduce the stress on the joints and stress on your back, so that you can live healthy and less medication for relieving pain.
థ్యాంక్ యూ డాక్టర్ గారు, మీ విలువైన సమయాన్ని ఇక్కడ స్పెండ్ చేసి చాలా విషయాలు మాతో పంచుకున్నారు. ధన్యవాదాలు.
నమస్కారం అండి.
ఇది ఇవాల్టి డాక్టర్ ప్లస్ కార్యక్రమం. నమస్కారం.
Please subscribe our YouTube channel M6tv.